Hi, my name is Moroga. I'm a BCom entrepreneurship graduate and have been practicing this science since grade 8 when I first started selling Tinkies at boarding school. Besides that, I'm also a music fan, so much so that I've gone as far as studying digital music production and I've created my own artistic works. I'm a self taught website developer and video editor. I'm a qualified real estate agent and I am currently completing my honors in business management at the University of South Africa. I'm a business accountant registered with the Southern African Institute of Business Accountants, a debt collector registered with the Debt Collection Council, and a registered Apple developer. I'm also currently working on a research paper concerning entrepreneurship and dentistry. So how did I stumble upon dentistry? Basically, I grew up in a household with two dental practitioners. My mom used to take me to work with her frequently during school holidays. So I've been at her dental practice as a patient, receptionist, practice manager, claims manager, and so on. Over the years, I've also done consultancy work for orthodontists and maxillofacial and oral surgeons. At some stage, I opened a profitable claims management bureau whereby I sold my shares to pursue my other interests. I've since opened a new business whereby I offer my services as a dental practice consultant. Today, I'm going to advise you on the business of dentistry and give you a breakdown on how you can improve the profitability of your practice through patient satisfaction. First off, let's take a look at the patient-doctor relationship. Not so long ago, the Hippocratic Oath was drafted. It's widely accepted that a Greek gentleman by the name of Hippocrates authored the oath. Just in case you don't know this, the oath in a nutshell is taken by healthcare professionals, swearing them in to practice ethically and honestly. If you think about it, this oath is a formal recognition of the importance of a practitioner's work, their conduct, and the manner in which they deal with their patients. These days, we have statutory bodies such as the HPCSA who basically give you a practice number and manage healthcare professions with a special emphasis on ethics. There's one specific phrase in the original oath which states, "If I fulfill this path and do not violate it, may it be granted to me to enjoy life and art, being honored with fame among all men for all time to come." Now, I just want to cast a spotlight on that word fame quickly. In this day and age, we associate that word with celebrities and the like. Fame among all men for all time implies a practitioner's status was legendary then, basically. Now, it is from this recognition of your importance that trust is born. A first-time patient walks in through your door knowing very well that you're not the only dental practitioner around and that they have chosen to seek your services for whatever reason, whether it could vary from the fact that the security guard downstairs pointed you out to the fact that you're well positioned or maybe you have a good reputation as a practitioner. Anyway, the patient has the idea that you're the right person to provide them with an efficient service and you'll not take advantage of their lack of knowledge in the field by performing unnecessary procedures. Now, you in turn receive a patient warmly with the idea in your mind that they can afford the treatment, are in possession of a valid means of tender, i.e., a medical aid card or money, and even if they can't pay fully at the time of treatment, they'll pay their account off in an honorable and timely fashion. Now, the first thing you must understand is that everything I've just said is implied tacitly, and only portions of this are likely to be vocalized by the individual engaging with the patient at the front desk. For instance, the receptionist will ask the patient if they have an appointment. It will be a yes or no type question. The receptionist will ask if the patient is there for the first time. Patient responds yes and promptly receives a form to fill in their details. Now that form, more often than not, will usually have a small contract between the practitioner and the patient, which binds the patient to pay even if their medical aid rejects the claims. If your practice doesn't have this little agreement, then you have failed to recognize a fundamental basic of business in that you protect the trust you invest in someone with a contract. The very next thing your receptionist will do is check for dental benefits so you can measure out exactly how much the patient can afford. Some practitioners go as far as asking for the payment history because some patients take advantage of the system, get multiple treatments done from multiple practitioners before the claims are processed. And then still, I want to stand here and point out that the relationship is supposed to be born of trust. With that in mind, the relationship that has come into existence has to be managed. A combination of humility and respect comes into play here. The patient has the responsibility to arrive for their appointment on time or to call in to reschedule if they won't be able to make it. The treating doctor also has the responsibility to attend to the patient at the agreed time. Now, in practice, there are always walk-ins who make this notion nearly impossible to implement. Out of respect for your patients, the doctor has the responsibility of apologizing for inconveniences caused with regards to time or any other factor that might spoil the patient's experience. Don't send your staff members to apologize. Do it yourself. Patients appreciate things like that. I can give you an example of when cars have to be recalled because there's a problem with a specific make. These companies basically own up to a mistake on their part. So who makes the announcement? The public relations team or the managing director? And what is the reaction from the affected parties, basically, just based on who makes the announcement? If you could just think about that. Patients appreciate little things like the practitioner remembering them and what they do for a living, asking them about their children, or even supporting their businesses. This calls for a great deal of humility. There's a saying in business that the customer is always right. Now, I'll be the first one to tell you that the customer is hardly ever right. That saying simply tells you that in business one must humble themselves. I mentioned earlier how the Hippocratic Oath rates the status of a practitioner to be that of a celebrity, or legendary for that matter. Well, the point is to get over your status and treat people like people. Now, if I take off my glove and I shake a street kid's hand, it can go unnoticed. But when, let's say, Princess Di took off her glove and shook an HIV positive man's hand, to this day, they still use that as a picture of humility. And that's how you use your status. Anyway, putting this thinking into action will put your practice on the right path towards what all professionals should strive towards: professionalism. The effort mustn't just come from you, but your staff as well. Everyone must maintain the trust, everyone must show respect and humility, then your practice will appear a professional as well. This is one of many patient-doctor relationship systems that a practitioner can apply to improve patient satisfaction. Just give me a second.